Welcome to today's lecture on the topic of lung transplantation. In this comprehensive script, we will cover various aspects of lung transplantation, including indications, evaluation of candidates, surgical techniques, postoperative management, long-term outcomes, and much more. So let us dive right in. Lung transplantation is a life-saving procedure for patients with end-stage lung disease, including COPD, idiopathic pulmonary fibrosis, cystic fibrosis, and alpha-1 antitrypsin deficiency. A multidisciplinary team assesses each case to determine candidacy based on disease severity, age, and other factors. The evaluation of lung transplant candidates involves a thorough assessment of the patient's medical, psychological, and social factors. It includes various tests to evaluate lung function, imaging studies, and assessments of overall health. Discussions about risks and potential complications are also part of the evaluation process. In the donor selection and organ allocation section of lung transplantation, the video discusses the importance of matching the donor and recipient in terms of blood type and organ size. Other factors, like age and cause of death, are considered. The allocation process prioritizes candidates based on urgency and medical need, taking into account disease severity, waiting time, and potential for survival. Organ procurement organizations and transplant centers work together to ensure fair distribution following established guidelines. Lung transplantation involves the replacement of one or both diseased lungs with a healthy donor organ. There are two primary surgical techniques used: single lung transplantation, SLT, and double lung transplantation, DLT. The choice of procedure depends on various factors, including the underlying lung disease, functional status, and surgical considerations. During the surgical procedure, the patient is placed under general anesthesia, and an incision is made to access the thoracic cavity. The diseased lungs are carefully removed, and the donor lungs are implanted, ensuring appropriate blood vessel and bronchial connections. The surgical team meticulously performs these intricate procedures, aiming for optimal functional outcomes and minimal complications. Immunosuppression is a critical aspect of lung transplantation to prevent rejection of the transplanted lungs. Patients receive a combination of immunosuppressive medications, such as calcineurin inhibitors, corticosteroids, and antimetabolites. These medications suppress the immune system's response, reducing the risk of rejection. However, even with optimal immunosuppression, rejection episodes can occur. Rejection usually presents with symptoms such as dyspnea, fever, and declining pulmonary function. Biopsies and immunological monitoring help identify rejection episodes, which are treated promptly with adjustments in immunosuppressive therapy. After lung transplantation, patients require intensive postoperative care. This includes close monitoring of vital signs, pulmonary function tests, radiological imaging, and regular bronchoscopies. The goal is to detect and manage any complications early to optimize graft function. Complications of lung transplantation can include acute rejection, infections, such as pneumonia and cytomegalovirus, bronchiolitis obliterans syndrome, and post-transplant lymphoproliferative disorder. Each complication requires specific management strategies, including adjustments in immunosuppressive therapy, antimicrobial treatment, and supportive care. Long-term outcomes of lung transplantation depend on various factors, including the underlying lung disease, patient age, comorbidities, and adherence to medical management. While lung transplantation can significantly improve quality of life and survival, there are long-term challenges to consider. Regular follow-up visits, including lung function tests, imaging studies, and assessment of immunosuppressive medication levels, are essential to monitor graft function and detect complications. Pulmonary rehabilitation programs and ongoing psychological support also play critical roles in helping patients adapt to life after transplantation. Lung transplantation can have significant effects on organs outside the lungs. Potential complications and extrapulmonary considerations include cardiovascular issues, such as hypertension and cardiac allograft vasculopathy, renal dysfunction, gastroesophageal reflux disease, bone health, and adverse effects of immunosuppressive medications. Close monitoring and appropriate management of these extrapulmonary factors are crucial for the long-term success of lung transplantation and overall patient well-being. Lung transplantation is a life-altering event that has profound psychological and social implications for both the patient and their family. Patients may experience emotional distress, anxiety, depression, and post-traumatic stress disorder. Pre- and post-transplant psychological support, counseling, and rehabilitation programs play integral roles in addressing these challenges.